Hi, this is Jim Bokshan from a company called Health Insurance Experts, and today I'd like to discuss the basics of Medicare. What do all these A, B, C, D letters mean? How do we enroll? And then maybe provide some helpful tips along the way to save us some money using the system. So let's get started. First of all, Medicare is health insurance for three groups of people: those 65 and older, those under 65 with certain disabilities, and anyone that has end stage renal disease, which is kidney failure. It's run by the federal government and it's administered by what's called the Centers for Medicare and Medicaid Services, or CMS for short. We get automatically enrolled if we're collecting Social Security when we turn 65, or after 24 months of being on disability, our Medicare will start the 25th month. So what happens is you get an information packet in the mail. It's going to include your little red, white, and blue Medicare card, as well as a form to decline Part B. So if you're still working at a company and you want to stay on the company plan, you can decline Medicare Part B for the time being, and then get it later when you retire and come off the company plan. So you have the option. You're not forced into taking Medicare because you're collecting Social Security. You have the option of taking it if you're working at a company and still want to stay in the company plan. Now, if we want to enroll ourselves, okay, because we're not collecting Social Security, there's three ways of doing it. One, we can go to our local Social Security office. You have to make an appointment, and then you can sit down with an expert there. And actually, you can kill two birds with one stone by not only talking about your Medicare benefits, but also your Social Security benefits when you go. Next, you can apply online. Now, this is the quickest, easiest way of doing it. You go to that website, www.medicare.gov, and it takes about maybe 15 minutes. You have to verify your identity, and then you sign up. So not too bad. Lastly, you can call the 800 number there and talk to someone over the phone and enroll. Again, you have to make an appointment, and it's going to last a good half an hour because they do have a lot of protocol, legalese verbiage to read to you. Okay, so it does take a little bit longer than applying online. Okay, so the timeline is you can sign up anytime 3 months ahead of your 65th birthday or the first day of the month that you turn 65. Okay, you don't have to be retired. You can still continue to work and collect Medicare. Now, here's your timeline. We have our birthday month to sign up. Now, Medicare will start the first day of the month that you turn 65. Now, there is an exception to that rule. If your birthday is the first of the month, your Medicare actually starts a month earlier. So if my birthday were, say, May 1st, my Medicare would actually start April 1st. For all others, it starts the first day of the month we turn 65. Now we have 3 months before and 3 months after, all right, to sign up. So we have a 7-month window. That's our initial enrollment period. Now, if we don't sign up during that time period because we're either covered through an employer plan or covered somewhere else, okay, we can delay it and start at any point when you want to come off that employer plan. Also, if you miss it and you're not employed, at the bottom there, you'll see there's a Medicare general enrollment period for those who missed it and want to sign up for Medicare. That's for January through March of every year, all right? It'll start the first of the month after you sign up. So A, B, C, D. The A and the B from Medicare, okay, come from the government. Part A is our hospital insurance. It covers things like your hospitalization, skilled nursing facilities, home health care, hospice care. Normally, we don't have to pay for Part A because either ourselves or our spouses worked at least 10 years or 40 calendar quarters. We paid our FICA taxes or self-employment taxes, and that now allows us to get our Part A for free. So if I never worked, but say my spouse did, okay, I can be covered under her plan or her coverage for Medicare. All right. So as long as she worked at least 10 years, I can stay covered under her Medicare eligibility. Now, if I'm covering myself because I worked the 10 years, then I'll be signing up under my own plan. So, do you need to sign up for Part A? Well, you have to consider it's free for most people. All right. The only time anyone really has to pay for it is they haven't worked the 10 years or 40 calendar quarters. They can still buy into Part A. All right. For everybody else, if myself or my spouse is actively working and covered under their employer plan, okay, I can stay covered under that plan if I want to. We don't have to go on Medicare when we turn 65. It's optional. Okay, if we're still working. So, what we have to ask ourselves is, does the employer have more or less than 20 employees? If it's more than 20, Part A is optional at age 65, and Part B you can decline and not take it. All right. If you're less than 20 employees at your employer, the insurance carriers don't have to pay primary for employees in small group plans. What that means is that Medicare is the primary payer. The health insurance company at the employer will be secondary, and that health insurance company is going to probably force you to sign up for parts A and B because they want to push off as many expenses onto Medicare as possible. So if you're still working at a company with more than 20 employees, the next line down, you'll see you can take care of it now to avoid any issues later. So what that means is if you continue to work at your company and it has more than 20 employees, you can sign for Part A and decline Part B. Because Part B we have to pay for. You don't have to pay for it if you're collecting or if you're getting your employer coverage for free or if you're just paying it through payroll deductions. All right. But if you want to get into the system, you get assigned a Medicare ID, you get the free Part A, and then you decline Part B until you retire or come off that company plan. At that point, you can get your Part B set up with no fees, no penalties, no waiting periods, easy peasy. Okay. Now, the one thing though, if you do sign for Part A, at the bottom, you have to stop contributing to your health savings account. So anyone that has an HSA account, you can use the money in that account for the rest of your life. You just can't deposit anymore once you become Medicare eligible. And that's having Part A or Part B. Now, Part B is our hot outpatient services like doctor's office visits, labs, x-rays, our diagnostic tests, outpatient therapy, our mental health services, and some of our preventative health services. So a lot of the miscellaneous things outside of a hospital setting. So things that are covered are, well, you have our one-time welcome to Medicare visit. It's kind of like almost like a physical, an annual wellness exam. Okay, a lot of the other things you'll see here are covered for free as our preventative services under Medicare. The one big one that's changed here in the recently is that our flu, pneumonia, and hepatitis B shots now actually cover more things like COVID shots, shingle shots, okay, and a lot of other vaccinations. So almost all vaccinations now are covered for free under Medicare. Not all, but most. Now, things that are not covered by Medicare: dental, vision, hearing, prescription drugs, long-term care, cosmetic surgery, alternative treatments like holistic treatments, overseas care, anything outside the US, routine physical exams, and routine foot care. Those are actually not covered by Medicare. They'll be picked up under your Medicare supplement or Medicare Advantage plan. Now, for Part B, we do have to pay for it. Okay, remember now, Part A is free, Part B we pay for. And the way they charge us is they look back 2 years. So right now in 2026, they're looking in our 2024 income. Whether you're single or couple, okay, you'll see the chart here. You find your income from 2 years ago, and on the far right is the cost you'll pay for your Medicare Part B every month. Now, for most of us, it's $202.90 a month. But for those that are in higher income tax brackets 2 years ago, they'll pay more for both Parts B and D. What's going to happen is you're going to be charged as they take your payment out of your Social Security check every month automatically. If you're not collecting Social Security, they'll bill you for it quarterly. Now, let's say you retired, though, since 2024, or you went part-time, you or your spouse. What you need to do is file an appeal with Medicare and tell them you're not making that kind of money anymore. You should be dropped down to the appropriate bracket. And by filing that appeal, Medicare will lower your rate, your monthly rate, to the spot you should be, okay, going forward for the rest of the year. Now, in December of every year, they will send you a letter telling you what the new rate's going to be for next year. At that point, if you need to file an appeal again to lower it, all right, you can do so. But again, you don't want to have to pay the government more money than you need to be, all right? So let them know that your income has dropped and you want to file that appeal. When can you enroll in Part B? Well, obviously when you turn 65, that's our automatic initial enrollment period. Okay, we all get in at 65. Now, there's also special enrollment periods. And the big one here is when you're working and you're still on your company health plan. You can leave that health plan at any time. That's, again, called your special enrollment period. You do not have to wait for their open enrollment at the company or the Medicare open enrollment. If in the middle of the year you want to just get off that plan, you can. You can continue to work, you just don't have to take the employer plan. Okay. The one thing you can't do is go on COBRA. All right. COBRA is not considered credible coverage by Medicare. Therefore, if you go on COBRA for at least 12 months, you'll be penalized, and that penalty lasts the rest of your life. I'll show you that on the next slide. There's also a general enrollment period, again, like I mentioned before, from January through March of every year, that for some reason, if you either missed your open enrollment or you want to come off your company plan or wherever the case may be, you can always enroll during that 3-month period. So here's the Part B late enrollment penalty. Okay, it's a big one. We don't want to mess around with this. It's 10% of your Part B premium for every 12-month period that you were eligible for Medicare but did not enroll. And that penalty lasts the rest of your life, as long as you have Part B. Okay, now for those that sign up during their special enrollment period, you don't have to worry. Okay, there's no penalty for that. But for those that did not sign up for whatever reason, when they were supposed to, when they turned 65 or when they came off their employer plan afterwards, right, they needed to sign up for Part B. And again, any 12-month period you've missed can result in a 12 or 10%, okay, penalty for the rest of your life. So right now, that penalty, okay, if you're looking at a 202.90, all right, premium every month, take 10% of that, that's an extra $20 a month you have to pay. And it'll go up every year as your Medicare Part B premiums go up. So again, this is one thing you really want to pay attention to. Do not delay the Part B enrollment when you're supposed to enroll. Now, in the employer, okay, if you're still working, and again, you have to determine how many employees the company has. All right, so you don't have to enroll if you're still working, you or your spouse, and you want to stay on that company plan. However, if the group has less than 20 employees, Medicare is primary and the health insurance is secondary. That health insurance company is going to want to get you on that Medicare plan, again, to push off as many expenses as possible. Now, if you have individual coverage, you have to sign up for Part B. If you're on COBRA when you turn 65, you have to sign up for Part B. So really the only time you don't have to sign up for Part B is when you're working at a company with more than 20 employees. You can delay the Part B enrollment until you retire or come off that company plan. And when your employment ends, that's your special enrollment period to then sign up for Part B without any penalties. So I love this slide because this is typical of the government, all right? No federal agency is responsible for informing individuals about their obligations and rules related to Medicare enrollment. What that's telling us is that even though the government does a terrible job of educating us on Medicare and how to enroll and what all the parameters are, so it's left up to ourselves to learn this. We have to teach ourselves. And if we make a mistake doing it, we're responsible. The only time we're not is in the next line. You'll see exceptions are only available to people who can prove they relied on misinformation from an agent of the federal government or other trusted source when making an enrollment choice. So what that means is if we had called Medicare for help and they gave us some bad information, okay, and we can prove it, then we can get out of paying that penalty. Or if that other trusted source, like maybe your HR department at work, or maybe you talk to an agent, an insurance agent, and they give you bad information. If you can prove it, then you can get out of paying the penalty. So to prove it, what that means is I recommend anytime you talk to someone from the government, whether it's Medicare, Social Security, the IRS, you take down the day and the time you talk to the rep, the person's name or ID number, right, what you talked about, take notes so that if it ever becomes a he said, she said issue down the road, you can go back and prove it that you were given that bad information. Okay, so kind of a little rule of thumb here to always kind of protect yourselves. Okay, and by doing so, we have to take notes. So I'm going to skip over Part C right now and jump into Part D because this is our drug coverage. Okay, drug coverage is required when you are Medicare eligible. So we can get it through a number of different ways. One, a Medicare prescription drug plan, which is like a standalone plan that will accompany our Medicare supplement plans. Or we can get it through most Medicare Advantage plans. Now, the beneficiaries, again, you are the Medicare beneficiary. This has nothing to do with life insurance, okay? You're the Medicare beneficiary. You have to have Parts A or B, and you have to live in the plan's service area, which means if I live in, say, Detroit, Michigan, I have to get a plan that's offered in Detroit, Michigan. I can't get a Wisconsin plan or Illinois plan, okay? But what we can do is we can compare the costs that Medicare and the insurance company is going to charge us, all right, to other sources like GoodRx. Now, GoodRx is a cash discount program that's offered at most pharmacies. And the secret there is that when you go to cash out for your prescriptions at the pharmacy, to ask them, is there a cheaper way for me to buy this prescription rather than using my Medicare insurance prescription drug card? And if so, they have to tell you by law. They have to tell you about other programs like GoodRx. There's a few other ones out there. Okay. So again, this is for everyone, not just people on Medicare. When you go to the pharmacy and you want to, pay for your prescription, ask them if there's a cheaper way to buy that prescription. Next, there's Canada. A lot of Americans get their prescriptions, brand name prescriptions, from Canada. It's perfectly legal right now to go through this, as the government has told us they will not prosecute anyone for getting prescriptions out of Canada. This has to be for individual use only, and you cannot get any kind of mental nervous condition drugs like Xanax, Zoloft, Adderall. Those are not allowed to be imported, but pretty much everything else is. And the rates can be 80 to 90% less than what we pay here in America. Next, there's manufacturer's discounts. I always encourage people who have to take a brand name medication that's very expensive to check with the manufacturer. You can go to their website, and almost all of them have discount programs for people that are either low income or maybe not. Maybe they just have a program because they want you to take the prescription and hopefully keep using it. So again, I always encourage people to check out the manufacturer's discounts that are available. Lastly, there's resources for low-income individuals, and a lot of them are not publicized. Why, I don't know. But if you call your local Department of Health and Human Services in your county or your state, they typically have 4 to 5 different programs available for people who have very low income, all right? And they're there to take advantage of. So yeah, check with your state and county to see if there's programs like that available in your area. Next, the Part B late enrollment penalty. It's not as bad as Part B, but if we don't have drug coverage when we first become eligible for Medicare, all right, or we've had at least a break of 63 days in service, maybe we left our company, they do allow for a 63-day break, all right? Anytime beyond that, we have to have drug coverage. And if we don't, we're going to get penalized. And right now, the penalty is 1% of the average national base rate Part D premium, which is $36 this year. Now, you say 1% of that is 36 cents. No big deal, right? Well, the next line becomes a big deal. It compounds for every month that you were eligible for drug coverage and you did not sign up. Now, I've had people come to me that never signed up when they're supposed to at age 65. And now at their age 70, they're saying, oh, I need a plan now. Okay, sir or ma'am. Okay, now you missed the last 5 years. You're going to have to pay a penalty. And that 36 cent penalty times 60 months is going to be added to your premium every month for the rest of your life. So as long as you have drug coverage, you'll have to pay that premium. Again, it's something you don't want to mess around with. Okay? The only time there's exceptions that are made is that if you have credible drug coverage somewhere else after you turn 65, you're okay. So if you have it through your employer, through the VA, the Veterans Administration, anything that's credible, you will not have to pay the penalty. But for those of us that did not have coverage at all, yes, you'll be responsible for that 1% penalty for every month you missed for the rest of your life. Now, with Part D, we also have to pay an extra premium, okay, through what's called IRMA, the Income-Related Monthly Adjustment Amount, all right? And again, that's based on our income from 2 years ago. So just like Part B, we have to pay more for Part D based on our income. And if you say an example here of a couple making $300,000, 2 years ago, they would each have to pay $37.50 plus the cost of the drug card plan premium every month. And just like Part B, if your income drops and you think you should be in a lower bracket, you can file that appeal with Medicare to get it lowered the following month. Now, access to covered drugs does change when you go from, say, a company plan, an employer plan, to Medicare. And the coverage and the rules are going to vary by each plan. Now, first of all, each insurance company that offers a drug card through Medicare is going to have a list of covered drugs. It's called a formulary list. And on there, you'll see if your drug is covered or not. However, there's going to be sometimes prior authorizations required for especially some of these brand name drugs. Because what Medicare doesn't want to do is pay for expensive brand name drugs when a cheaper alternative is available. All right, so through the insurance company now, okay, and they're going to come in, they're going to send you a letter saying, well, you're taking this really expensive medication for high blood pressure. We want you to try the cheap generic first and see if that works. That's what's called step therapy. Because then, if that cheap generic doesn't work, then you'll take the next step up to the next more expensive generic. If that doesn't work, you try the next generic available. That is taking the steps up. Now, to avoid all that, you can have your doctor write a note and explain to the insurance company that no, my patient's already tried those generics. He is allergic to them, or she, it upsets her stomach, or whatever the reason may be. Okay, if you have the doctor write the note to the insurance company, you can hopefully get that step therapy waived. Lastly, there will be quantity limits on prescriptions through Medicare. Not so much for general medications, but it's the ones that are mental nervous related, the opiates especially. Okay, because we're cracking down now, especially on the painkillers, you'll see that a lot of times you won't be able to get a 90-day supply. You might not even be able to get a 30-day supply. You might only be able to get a 7-day supply at a time, depending on that strength of that prescription. Okay. Lastly, you should look at pharmacies, where you're buying your prescriptions from. Okay, because there's non-network pharmacies, okay, and in-network pharmacies. They're also called preferred or standard pharmacies. And what you're going to want to do is go to that pharmacy that's in the network and a preferred pharmacy. You'll pay lower co-pays when you use that pharmacy versus using an out-of-network or standard pharmacy. Now, that formula list that we talked about, okay, you're going to see the list of drugs that each insurance company covers. They're going to be listed in 5 categories. Tiers 1 and 2 are your preferred and non-preferred generic drugs. Tiers 3 and 4 are your preferred and non-preferred brand name drugs. And Tier 5 is your specialty drugs. Now, why this is important is because what one insurance company might be offering at, say, a Tier 3 brand name level, the same drug might be covered at a different insurance company under Tier 4 at a non-preferred brand. And that could mean the difference of paying maybe a $40 copay on a Tier 3 drug versus a 40% cost on a non-preferred brand. So you could be paying a lot more money for that same exact prescription if the insurance companies differ on where they have it on what tier. Now, all this is public information. You can go to Medicare.gov and get this information on all the different drug cards and see if your drugs are covered and at what level. You can also go to the individual insurance companies. Down at the bottom, I listed one that stands for BCBSM, Blue Cross Blue Shield of Michigan.com/Medicare. Enter drug list, and you can see exactly what drugs are covered and at what level. We can also do that for you, all right, to do the homework. Again, we've been doing this over 33 years, and we'd love to help you. Now, Part D, the way it works when you buy prescriptions under Medicare is you might have an annual deductible. Now, typically, this is only for people who are taking brand name drugs. The deductible can be no more than $615 in 2026. And after you pay that, then you'll go into paying your copays. If you're not taking a brand name, you immediately go into what's called the initial coverage and pay copays on your prescriptions. You'll keep paying these copays until your maximum out-of-pocket spending limit has been met, which is $2,100. What that means is that the most a person has to pay for prescriptions, covered prescriptions, under Medicare is $2,100 a year. After that, you reach what's called the catastrophic coverage level, at which point then you pay nothing. Between the insurance companies and Medicare, they will pay for the remaining cost of your drugs for the rest of the year. Now, the key here is covered drugs. Okay, your prescriptions have to be on that formulary list and be covered for it to apply to this $2,100 threshold. If it's not, you'll be paying out of your pocket for that, and you'll be paying for the whole year because there's going to be no threshold. So again, you're going to want to find a drug card plan that has all your drugs covered so this $2,100 maximum threshold applies to you. Now, there's also what's called a prescription payment plan out there. What that does, it will budget your prescription costs throughout the remainder of the year. So let's just say you do start in January with this plan, and you know your costs are going to be $2,100 for the year because you're taking a lot of expensive medications. Okay, you can set this up with your pharmacy and the insurance company. So they'll take that $2,100, divide it by 12 months, so that your cost then will be 1/12 of the $2,100 or $175 a month. versus having to pay that big deductible up front and the big, maybe say 20% or 40% copay up front. So you can budget similar to what you can do with your utility companies, like your gas and electric companies. You can take that whole annual bill, divide it by 12 months, so you can budget yourself, and it's a little bit more affordable to do that. Now, let's go into the Medicare Advantage and Medicare Supplement plans. These are your two options when you go on Medicare. Now, we'll start with the first one. Now, this is called Part C, Medicare Advantage. All right. So, your health insurance is going to be now covered through the insurance company, similar to your drug card. They're offered throughout the country by insurance companies. Your premium is not based on your health. They don't even ask any health questions. Your coverage can't be denied because of your health conditions. All right. But what's going to happen is that Medicare is going to basically work with the insurance company, but the insurance company is going to handle everything for Medicare. They're kind of taking over the administration for parts A and B from the government. All right. So that's why you're going to have really everything put through your card, your Medicare Advantage card versus Medicare. So how do they work? First of all, you still have your original Medicare. You still have your A and B. You still have to keep paying your Part B premium. You're still going to have the same Medicare rights and protections, okay, same covered services, but now because the insurance company is handling everything, you're going to get one card, one bill, one explanation of benefits form from the insurance company. However, what they'll also do, many of them will do, is add extra benefits like vision, dental, hearing, a free gym membership. You'll probably also have your drug card included along with your Medicare Advantage plan. So what they do is they keep all this under one roof, and it's being, again, administered by the insurance company. But the one drawback is that there will be a network of doctors and hospitals you have to use to participate. So they come in two different forms, actually three: PPOs, HMO networks, and a kind of a hybrid called a point of service network. So as a refresher course, the PPO networks are the big networks where most doctors and hospitals accept it. You don't need referrals to get service done, and you can pretty much go anywhere you want, anytime you want. The HMOs are just the opposite. They have smaller networks of providers. You have to name a primary care doctor. You have to get referrals from that primary care doctor to go see a specialist, okay? And the insurance companies have a little bit more control over your health insurance. The hybrid in between is called a point of service plan. That's kind of it's a hybrid of an HMO plan that you can actually go outside the network. And they allow you to go outside the network if you want to. Okay, so it's kind of a hybrid between the HMO and the PPO. Okay, but again, whenever you have one of these plans, you're going to want to stay in network with a Medicare Advantage plan. Now, the other drawback of Medicare Advantage plans is that they will require more prior authorizations. Meaning, if I need a knee replacement or hip replacement, I have to get a prior authorization, okay, from my doctor. Okay, it's like a little doctor's note, which he or she has to send to the insurance company to get it approved, because they're not just going to approve it like any major expenses without these prior authorizations. The Medicare supplement plans don't require that. The Medicare Advantage plans do. So when can you enroll in a Medicare Advantage plan? Well, obviously when you turn 65, when you become Medicare eligible. We also have an annual election period from October 15th through December 7th of every year. That's called our open enrollment period in the fall. Now the coverage will start January 1st of the following year, but everyone has a chance to change plans and make any kind of switches during that time period for the following January 1st. We also have a second open enrollment period for people who have Medicare Advantage plans from January through March of the following year. It's called your Medicare Advantage open enrollment period. So what you're allowed to do then is if you don't like your Medicare Advantage plan, you can switch to a different one. You can also disenroll from Medicare Advantage and go back to original Medicare and get a Medicare supplement plan along with a Part D drug card plan. Now, you may not have a guaranteed issue right there. Okay, you may have to answer questions on your Medicare supplement application for health questions, but at least you have the opportunity, if you want to, go back to and get a supplement. Lastly, there's a continuous enrollment for anyone who's institutionalized, meaning if you're living in any sort of institution, including a nursing home or assisted living facility, you can change your Medicare Advantage plan at any time during the year. You don't have to wait for any open enrollment periods. Now, the supplemental plans. Okay, these are the older side that have been around longer than the Medicare Advantage plans. They're also called Medigap plans. So when you hear the term Medigap, it's the same thing as Medicare supplement. These are also offered by your health insurance companies. They supplement what original Medicare doesn't cover. So typically Medicare doesn't cover like 80% of the costs. All right. The Medigap supplement and the Medicare Advantage will pay the other 20%. All right, less your copays. Now, you'll still have Medicare that you have to carry your Medicare card along with you, but you're going to have that Medigap or Medicare supplement plan to complement it. You'll also have to get a drug card plan because prescription drugs are not covered under Medicare supplements. The one thing you can't do, though, is have both. You can't have a Medicare supplement and a Medicare Advantage plan. You have to have one or the other. But now with Medicare supplement plans, you can see any doctor you want to that accepts Medicare. So any provider in America that takes Medicare will take your Medicare supplement. There's no networks, there's no PPOs, there's no HMOs. And again, that drug card you'll have to be purchased separately along with any dental, vision, or hearing coverage because those are not covered by Medicare and they're not covered by your Medicare supplements. Now, down at the bottom, you're going to see the costs are going to vary a lot on your Medicare supplements. The things they look at are your age, your gender, which plan you take, the insurance company you go with, and where you live, along with things like your smoker status. Okay. They can also ask health insurance questions, okay, about your health history, okay, if you're not getting in on the first time. All right. So beneficiaries pay a monthly premium, okay, and it's been going up a lot for these type of plans, okay, versus your Medicare Advantage plans where a lot of them are free. Now, the best time to buy this supplement is during your guaranteed issue period. That is when you first get into your Medicare supplement plan. Either you turn to age 65 and you're eligible now, or you stay on your company plan and now you're retiring and you're going to sign up for Part B at that time. So that is called your guaranteed issue period, where no health questions are asked on the Medicare supplement application. You get in by just putting your name, address, telephone number in, you sign it, you're in at the base rate for whatever age you're at. Now, outside of that open enrollment period, okay, you're going to have to answer medical questions on their applications. And you can have an increase on the rate based on your health conditions. You can also get denied, okay, for your Medicare supplement if your conditions are too severe or if you sign up late. So again, when you first sign up, you're first eligible for your Part B, there's no questions asked. But after that, if you say you start with a Medicare Advantage plan and you want to switch over to a supplement down the road, then yes, the supplement insurance company can ask health questions on their applications and they can either raise your rate or deny you coverage. So down at the bottom, you'll see that these insurance companies, I'm talking about Medicare supplement plans, they're all standardized. You don't have to worry about there any changes, okay, from company to company on these Medigap policies. If you pick a plan, it's the same type of plan that all the insurance carriers are going to offer. Okay, for instance, here they are. They're come lettered A through N. Okay, now a couple of these are no longer offered to people turning 65. All right, for instance, plans C and F are gone. You can still get into those if you're old enough and you qualify. But for any newcomers, they're not allowed. You can only get the remaining letters. And what most people are going with now are either Plan G or Plan N. And the reason people like that Plan G, as you'll see here on this slide, is that it covers everything except for your Part B deductible at 100%. Now, foreign travel is covered 80%, but again, everything else in the US is going to be covered in full for you except your Part B deductible, which this year is $283. So that's why when people come to me that have serious health issues and are going to be using their health insurance a lot, I recommend a Plan G because then they can see that 100% of all their office visits, labs, x-rays, MRIs, hospital visits are going to be covered, okay? And all they'll have to pay for the whole year is a one-time annual deductible of $283. So they can sleep better at night knowing, hey, guess what? I don't have to worry. My worst case scenario out of pocket is $283. Not like with a Medicare Advantage plan where I have to pay copays every time I use it. Now, Plan N is very similar to Plan G. The difference is you still have to pay that deductible, but you also are responsible for any Part B excess charges. That's when you see a provider under Medicare and they charge more than what Medicare is going to pay them. So they can actually balance bill you for what the portion of that Medicare is not covering. So that could be your Part B excess charge. You'll also have to pay copays for office visits and emergency room visits. Now they're small, Typically, the emergency room visit's a $50 copay, doctor's office visits are a $20 copay. And you will save money on the premium with a Plan N versus a Plan G. So here are your two options side by side. Okay, on the left side, we have the Medicare supplements. We're going to have to carry 3 cards in our wallet or purse. We have our Medigap policy plan, we're going to have our standalone Part D drug card plan, and we have to have our Medicare card. Okay, so you have to show all 3 when you use it. Whereas on the flip side, the right side, Medicare Advantage plans, Part C, you only have to carry the 1 card from the insurance company. That's going to cover everything. For instance, your office visits, labs, x-rays, when you go to the dentist, when you go to the optometrist, the pharmacy, you use the 1 card for all your different needs that are covered under the plan. But let's do the math because this is important. This is for a lot of people, when they retire, they're living on a fixed income and they can't afford a lot of extras. So with a Medicare supplement, you're going to be paying more, like we said before. And in this example, I'm using a 70-year-old male, non-smoker in Southeast Michigan. Typical cost for a Plan G is about $176. I have to add a drug card to that. Typical drug cards can cost $10. So you have a total of $186 for that Plan G and drug card. Versus if that same person were to go with a Medicare Advantage plan for free, right? They're looking at a savings over $2,200 for the year by going Medicare Advantage versus Medicare Supplement. But down at the bottom, you'll see the Medicare Supplement Plan G maximum out-of-pocket cost is only $283. Versus with Medicare Advantage plans, I'm going to be paying copays every time I use it. So there's a max, thank gosh. Okay, it's an average about $6,000 on a Medicare Advantage plan. That's a worst case scenario for all those little small co-pays out of pocket. Now, it ranges anywhere from, say, $4,900 to $6,900 on these plans. I'm using $6,000 just as an average. But that's a worst case scenario. That's not a deductible. It's a worst case for all the small co-pays added up. Less than 4% of people nationwide ever hit that $6,000. So it's really hard to hit when you're only paying $100 here, $200 there to hit $6,000 for the year. You have to have one heck of a bad year to hit that. Now, there's another option you have. When you get that free Medicare Advantage plan, you can add what's called a hospital indemnity plan to that to cover the hospital copays. So a lot of the hospital copays on these Medicare Advantage plans are going to run, from $350 to $450 a night, okay, for up to maybe 7 nights. With this Medicare, hospital indemnity plan, it costs about maybe $30 a month to have it, but then it'll pay your copays for the hospital when you go. So if you think about that, you'll have a free Medicare Advantage plan, and for $30 a month, all your hospitalization costs will be covered, okay, that Medicare charges. Now, you might have some additional ones like a telephone in the room or a private room, but anything that Medicare covers will be covered under your hospital indemnity plan and Medicare Advantage. So again, $30 a month, that's $360 a year. That's less than typically 1 night in the hospital. So it kind of protects you from any major out-of-pocket expenses for hospital visits. Now, those of you that are still working and you're deciding whether you want to stay on the employer plan or going on individual Medicare, what you have to look at, first of all, on the left-hand side, is the employer plan. What type of plan is it? Is it an HMO? Is it a PPO? Does it have a big deductible? What's my cost? How much are they taking out of my payroll to pay for it? Versus on the right side, if I go to Medicare and get an individual plan, Part B is going to cost me typically $203 if I'm in a normal income tax bracket. And if I get a Medicare Advantage plan on that, a free one, that's all I'm going to pay is the $203. So if I'm paying more than $203 through my company plan at work, I might want to decide to go on an individual Medicare plan. However, if I go on that plan, if I have any dependents also on the plan with me, they're going to need good coverage. Because if I come off that plan, my dependents have to come off as well. Now, if I work at a company with more than 20 employees, my dependents can get COBRA for up to 36 months. Okay, it's not 18, it's 36 when someone goes on Medicare. However, they can also look at the COBRA cost, which is typically very expensive, to other sources like an individual health plan through the marketplace. Now, they do have high premiums and they do have high deductibles, but it could be still less costly to go on Medicare for myself and maybe get my spouse a individual plan or have her go through COBRA. Okay. The other thing I have to take into consideration is that, my employer plan is taken out of my paycheck pre-tax, but with individual Medicare, I would be paying with after-tax funds. So that comes into play too. So as you'll see, there's a few questions you need to answer and some number crunching you have to do to determine if it's better to stay on the employer plan or go on individual Medicare. But typically with the individual Medicare, it gives you much better coverage than most employer plans out there now. Because of the cost of the health insurance, the employer plan has been forced to increase deductibles and out-of-pocket cost to the tune of easily $6,000 and $7,000 for a maximum out-of-pocket, compared to Medicare, which could be a lot cheaper, especially if you go with a Medicare supplement, where you only pay $283 out of pocket. So again, a lot of questions to be answered when you switch plans. So there's a form of Medicare Advantage plans I want to cover for people who have both Medicare and Medicaid. They're called DSNPs. That stands for Dual Eligible Special Needs Plan. So if someone is fully covered by Medicare and Medicaid, they can get one of these DSNP plans. Now most of them are HMOs, but they'll basically pay nothing out of pocket. There's no monthly premium, there's no monthly deductible, there's no cost for office visit copays, prescription copays, all right? But they'll also get all the bells and whistles that the insurance companies offer, like dental, vision, hearing. You might get some cash to pay for over-the-counter items, groceries and utilities. You might also have benefits like free transportation, Meals on Wheels, and gym memberships. So again, if you know anyone, you or someone you know, qualifies for both Medicare and full Medicaid, not partial Medicaid, you have to get full Medicaid coverage, they can qualify for one of these DSNP plans and get basically a plan they pay nothing out of pocket. Also, for the veterans, anyone that has the VA coverage should also look into a Medicare Advantage plan, because then they get the best of both worlds. They can use the VA program when they want to use that and get many free things through the VA. But they can also use the Medicare Advantage plan for things they want outside of the VA system. Because the VA does require like authorizations for operations and other big ticket items, they typically have a 4 to 6 week approval time. Also, they have to use their facilities, the VA facilities. So a lot of veterans will come to me and say, well, Jim, if I'm having back surgery or eye surgery, I don't want to use the VA providers. I want to use my own. I want to go to U of M Hospital or Corewell or someplace like that here in Michigan. All right, I want to use my own provider. So you can do that with a Medicare Advantage plan. You can use the VA when you want to use that, and then the Medicare Advantage for everything else. Because they don't have waiting periods for operations. You don't need a lot of the waiting, or pre-authorizations that you do with the VA. You also get the bells and whistles, like the dental, vision, hearing, the gym memberships, and all these extras. In addition to a lot of the insurance companies now are offering money back toward Part B for a veteran. Now, how that works is that the $202.90 per month that we have to pay for Part B, what a lot of these insurance companies are doing is offering money toward that. They'll actually pay a portion of that for the veteran. And I know one insurance company I like the best, they're offering $130 a month toward a veteran's Part B, which that means that $202.90 minus the $130 comes out to $72.90 a month. That's all the veteran will have to pay for Part B. Again, that's just a gimme from the insurance company to get you to enroll. So again, something to consider if you're a veteran. Now, coming to the end here are the Medicare do's and don'ts. Do enroll when you first become eligible for Medicare. The one exception is that you don't need to enroll in Part B if you continue to work and you're under a large employer plan that has more than 20 employees. You can stay in that plan for as long as you want, you or your spouse's plan, as long as you want, and then come off at that point, again, with no fees, no penalties, no questions asked when you're getting into Medicare. Do get and keep drug coverage and become Medicare eligible. You have to have drug coverage of some sort when you're 65 and older. And that can be through your employer. It can be through the VA. You have a number of sources where you can get that, but you have to have it. If you don't, you will get penalized when the government finds out, and that lasts the rest of your life. Now, this sounds selfish, but it's not. Do use a qualified agent to help you guide you through the enrollment process. Agents don't charge. Most of them will not charge, a client to help them. They get paid by insurance companies, so there's no reason not to use an agent. Now, people that try to do this on their own, they can make mistakes, and those mistakes can result in lifetime penalties. All right, you just know what you don't know what you don't know. And that's why I tell people get some help by going to the internet or by talking to friends and family. That can basically end up hurting you in the end. Use a qualified agent. Next, do appeal the extra charges for parts B and D if you were in a higher income tax bracket a couple years ago and your income has dropped now, either because you retired, okay, that's a work stoppage, or you went part-time, that's a work reduction. Those are both legitimate reasons, okay, that the government, Medicare, will lower your Part B and D rates, okay, if you're in a higher income tax bracket and you need to drop down to a lower one. Okay, so don't wait for Medicare to, the 2 years to change your rates. Take action now, file that appeal, and they'll lower your rate literally the following month. Do research prescription costs, as there's a number of ways to reduce those costs, including using programs like GoodRx, right? Getting prescriptions out of Canada, getting manufacturers discounts, all right? Or your state and county local assistance programs for people who have lower incomes. Also, consider the Medicare add-ons, okay, from the insurance carriers like dental, vision, and hearing when you make your decision. For instance, if you look at a Medicare Advantage plan versus a Medicare supplement based on medical coverage alone, you're kind of doing yourself a disservice, because if you do need major dental work, hearing aids, okay, things like that, those are very expensive. They're thousands of dollars. Medicare Advantage plans include those automatically, or most of them do. The Medicare supplements don't. So again, keep that in mind when you're making a decision. Do I need a lot of dental or vision work or hearing aid coverage? Because then the difference in cost that you're paying out of pocket for that Medicare Advantage plan might be a lot cheaper than the better coverage you get under Medicare supplement plans that have better coverage for health insurance, but no coverage for dental, vision, or hearing. Now, the don'ts. Don't contribute to an HSA once you're Medicare eligible. If you do, and the government finds out, you'll be taxed and penalized. Don't take COBRA when you're on Medicare. Once you become Medicare eligible, okay, if you go on COBRA for more than 12 months, all right, you're going to be penalized that 10% penalty for every year you're on COBRA that you did not go on Medicare. And again, that lasts the rest of your life. Don't work directly with an insurance carrier when enrolling. What that means is, yeah, you might go to Blue Cross just because they have the name recognition and all that. They have good plans, but so are the other carriers. Okay, so it pays to shop around to all the carriers when looking at a plan, especially in open enrollment in the fall, because plans change every year. What might be good this year for yourself might be better with somebody else, another carrier, in the following year. So it kind of pays not just to stick to one insurance carrier. I mean, appreciate the loyalty, but again, you could be doing yourself a big disservice by not doing the shopping every open enrollment. Do the homework, all right? Then, my biggest pet peeve in this industry: don't settle for the same plan your friend or family member has. You have to investigate the options that are available to you and get the plan that fits your needs and your budget. Just because your brother or sister or friend has a plan they like doesn't mean it's going to work for you. You're going to have different doctors. You're going to take different prescriptions, right? You have different medical needs and budgets, okay? So you have to, again, do some research on your own or have an agent help you. Okay, it's very important because it's not one size fits all. Everyone's different. So you need to get the plan that fits your needs and your budget. Lastly, don't enter your contact information online or give it to anyone calling you when researching Medicare. You could be sorry, because what they're doing now, right, there's a lot of scams out there, as you know. They can take your information and they can actually sign you up without you even knowing about it. I've had clients, and this has happened to now last few years, where I call them and ask them, like in January, February, I said, hey, I see you changed your plan. Why is that? And they said, well, I didn't change my plan. And I said, well, guess what? Someone changed it for you. Did you talk to anyone? And they said, well, yeah, I talked to one guy, but I didn't sign up with him. Well, guess what? If you give an agent just a little bit of information, personal information like a name and telephone number, name and address, they can actually Google the rest and sign you up without you knowing about it. So be very careful about who you're talking to over the phone, because again, they can take that information and sign you up without you knowing about it. Also, when you go online and look for information, okay, and I've had this happen to clients where they were looking for information, they went to a website, they put their name and telephone number into it, and no sooner did they push that send button, and they were flooded with telemarketing calls from agents all across the country trying to sell them a plan. Because that website, even though they promised you information on Medicare plans, sold that information, your name and telephone number, off to all these agents, and now they're flooding you with phone calls, and they could last weeks. Okay, so be very careful when you give out your information to anyone online or anyone over the telephone. So, speaking of contact information, the Medicare.gov, great website. It's easy to read, easy to understand. Okay, so if you need information, you can go there. If you still have questions, you can call Medicare. That 800 number is the one actually we use. And I would say, a lot of times they're right on with their answers. Now, every now and then, people do make mistakes. If there's an issue that comes up where it differs from what maybe your agent's telling you, what I do for my clients is I do a three-way call. I get myself, the client, and Medicare on the line at the same time. Now, I've been doing this over 33 years. A lot of the Medicare reps, my guess is that have been doing it less than 5. So they can make mistakes. I can make mistakes, but at least I know how to correct them. And if you find this happening to you, call me. I'll be happy to work with you on Medicare, with Medicare, to get it corrected for you. Next, the Do Not Call registry. Like I said, you can get flooded with phone calls from agents all across the country, all right, trying to sell you a plan. This happens a lot during open enrollment in the fall. Okay, they buy these lists, all right, these lead lists, and they'll start just dialing for dollars, calling people and see if they can change their plans. Okay, selling them something they probably don't even need. So to get away from that, or at least to limit them, you can put your telephone number on the Do Not Call list through this donotcall.gov website. Now, it lasts up to a year, so you do have to renew it, and it's supposedly will take care of most of the phone calls, because anyone that calls from a domestic phone line in the U.S., okay, if you're on that Do Not Call list, they're supposed to check it first before they call you. And if they do call you, you can actually report them, and the fine is $50,000 that they can get fined by calling you when you're on the Do Not Call list. Now, a lot of these big companies, these insurance companies, have gotten around that because they're going offshore with their telemarketers, meaning they're not being called. The calls aren't coming from the U.S., they're coming from overseas. So that doesn't apply. This Do Not Call, the fine for calling people on a Do Not Call list doesn't apply. So they're getting around it. But at least they can, at least limit the calls from the domestic callers. Prescriptions. For local pharmacies that GoodRx I was telling you about earlier, you can go to their website, you can put your prescription in, and you can see what the cost is at all the major pharmacies in town. And it's really kind of interesting because you can see a huge difference among pharmacies. I had one woman I worked with, I put a prescription in, it was a $20 copay at Kroger's. The same copay at CVS was $200. Same exact drug, same exact everything. But by going to GoodRx and be able to shop the different pharmacies, you can see the difference, okay, on what the different pharmacies are charging for your prescription. So basically, you can do the shopping right from home. Now, Canadian pharmacies, this is where we come in. We can show you how to get the prescriptions out of Canada. I know a lot of the brand names are 80 to 90% off. I know the big one that we see a lot of people asking about is Eliquis. Eliquis right now it used to be $1,700 a quarter. I think the cost has come down a little bit this year. But in Canada, it's actually can be shipped over here for $265. All right, that's over a $1,500 savings every single quarter. All right. Next, if you're a diabetic, there's a website here that we use for our diabetic patients, our diabetic clients, where you can get help paying for insulin and supplies. All right, if you're if you're low income, you can get some low cost prescriptions and insulin, okay, and supplies out of this website by just signing up. Same with the next one too. For anyone that comes to us that are lower income tax brackets, we suggest going to these websites to get help. Because if you apply and you're qualified, you can get very good Medicare supplement plans, Medicare Advantage plans at a lower cost and actually help with prescriptions. Okay. Next, the questions. If you have any questions, that's what we're here for. Again, we've been doing this a long time. We enjoy helping people. Okay. There's no charge. Okay. We don't charge for any services. We get paid by the insurance companies. So if there's anything you need, feel free to reach out. Our email, or we use the jboke99, that's for me, at gmail.com, or our website, the www.thehixperts, right? It stands for healthinsuranceexperts.com, or our phone number. Just call us and we'll be happy to help. So if there's any questions, again, reach out. We'd be happy to help. I hope you've learned something today from this. If not, all right, please feel free. If there's still questions and if there's something that's confusing, that's what we're here for. Okay? Be more than happy to help. I've been doing it a long time and hopefully continue to do it for a long time. So thank you for joining. Again, reach out anytime and good luck.